Hello, welcome back. The topic today is the question most of the patients ask. Doctor, I have a thin motion or filmy motion or stringy motion or even ribbon-like motion. So I do have hemorrhoids because of the hemorrhoids. Do have this kind of thin. Most of the time, if somebody has a very thin, filmy or ribbon-like or even stringy motion, first and foremost reason is constipation. So anyone who is constipated, usually we all know because of that the water from the motion is absorbed, so they become dry, thin. So the signs and symptoms of constipation, they have a bloated abdomen pain. They pass alternate day motion, or the first 5 centimeters is very dry. They have to push hard for the motion. See, these are the first and foremost reason for thin or narrow or stringy motion. Is the constipation. Okay, the next is very important thing is cancers or any tumors in the colorectal or anal region. So any colorectal tumor, so the colon, the overall is almost a meter length, and the last 25 centimeters, if there is a growth or there is a tumor, then it can obstruct the passage of the motion. So the motion can be little hard to come, and it may be little filmy, thin or stringy. So the other reasons are all even irritable bowel syndrome or infection. So any infection, it's a bacterial infection or a worm infestation, can make the consistency of the motion little change that, and it can cause thin, filmy or narrow motion. And other reasons, suppose even young age, young children, they can have a because of the development, they may have a normal thin motion. But if a female has a fibroid uterus, so the rectum is like that, your uterus is like that, and your urinary bladder is like that. So the rectum is through which the motion is coming. Suppose they have a fibroid posterior, we call that the back side, and the fibroid is so huge and it's compressing the rectum, then they can get a thin, filmy or even stringy, whatever, very narrow motion. So according to the age and according to the diseases, usually the causes of for the narrow or thin motion varies. So it's always better to go and see the doctor, especially if you have 40 years with that stringy or narrow motion comes with blood, with weight loss or loss of appetite. Then it's a mandatory to do a colonoscopy. See a doctor, do a colonoscopy. So the most common cause is constipation, or it could be cancer, colorectal cancer. So always check with your doctor and get yourself examined if needed, do a colonoscopy and find out the reason. Thank you.